finally decided I had PTSD after, I think it was 7 years. At the time I was separated from my family because of the PTSD and all the problems I had caused. During that time, my son would not have anything to do with me because of the side effects of the medications I was taking. I was taking antipsychotics, benzodiazepines, and methadone all at the same time for chronic pain and PTSD. When I was released from the hospital, I was told that the majority of the drugs I was taking had suicidal side effects, which I did not know prior to that. And I was also told that I had to move back in home, in my house, because I needed someone to help me monitor my medication intake. At that point, I hadn't really considered the medical marijuana program because I'm a veteran and I knew that the VA could, at that point, they could have taken my benefits or not seen me. But I had a family discussion, and the only person that actually objected to it was my daughter, Patsy, and she would like to discuss something. So, thank you.
Hi, my name is Patsy, and I'm here to talk about the relationship between me and my father and I, and how cannabis affects it. Cannabis has brought many good things into our relationship, such as him being happy, and he's much more active and he spends more time with me. I'm so happy that my dad has medical marijuana in his life because I feel without cannabis, he would never have a positive outlook on things and he would be in his room all day. This program has given my father back to me. Thank you.
My name is Stacie Wysong. I've been in the cannabis program since October 2009. I have MS. I have MS-related pulmonary hypertension. I've blown a hole in my heart, and I've got a number of ailments that marijuana does a great deal of relieving my day-to-day stress. With the MS, stress is pretty much a death sentence. The more stressed I get, the more chance I stand of having the MS destroy more of my brain and more of my nervous system. I'm on immunosuppressive drugs, so I'm pretty much a prisoner in my own house. There are a number of things that the marijuana helped me with day to day, and I know there are a number of other people that it can help too. In regards to you, members of the medical staff, what you do is very important, but I want to remind you, nothing you do matters anything if you can't get your card renewed. If I don't have the documentation, then I'm spending a day with so much nausea and pain that there's no point in even describing it to you because you won't understand it. You can see it and have some inkling of what it's like, but trust me, I used to be very healthy. A pilot, a skydiver, mountain climber, snow ski, water ski. I've lived a very wonderful life. I've been very fortunate. I had no idea the kind of suffering my fellow people go through. You should know. We need you to know. There's a lot of suffering that doesn't have to go on. We're dependent on you. You're underfunded. You're villainized because of what you're doing. You're trying to help. I appreciate it. But like, it's very, very hard to get across to people who've never been in this situation or even tried to care for somebody in this situation. It's tough to know there is at least relief. You may not solve my problems, but if there's relief, why do I have to suffer because somebody just decided that, you know, pardon me for saying it, but blacks and Mexicans like marijuana. You know, it's free, it's cheap. We can't have that. You know, that's where it all comes from. Check with Great Britain, check with France. Even check with India. India in the Middle East has done some fantastic studies that aren't biased. They want to know what it does to help. I want them to know too, because I know it's helped me. I don't think I'd even want to be here today if it wasn't for marijuana. And having an expired card, every moment is a struggle. Every moment is me trying not to throw up on this microphone. You want to talk about insomnia? You go a week without sleep and you'll know what torture is. Waterboarding is nothing. Sleeplessness will make us crazy. We have an opportunity. People are suffering. We can help them. Please be an advocate. Look at the countries that have already started. Look at their studies. Just because they're not American doesn't mean they don't have good information. Thank you very much for your time. Thank you very much for coming here. I hug you if I could.